Understanding dissociation and dissociative identity disorder. Dissociation and dissociative identity disorder, DID, are complex psychological phenomena that often arise as a result of severe trauma. This lecture will explore the definitions of dissociation and DID, how to identify if you have DID, the impact of untreated DID, and strategies for living a healthy life with DID. Dissociation. Dissociation is a mental process where a person disconnects from their thoughts, feelings, memories, or sense of identity. It is a way the mind copes with too much stress or trauma by distancing itself from experiences that are too overwhelming. Types of dissociation. Depersonalization, feeling detached from oneself, as if observing oneself from outside the body. Derealization, perceiving the external world as unreal or distorted. Amnesia, loss of memory about certain periods, events, people, or personal information. Identity confusion or alteration, a sense of confusion about who one is or experiencing multiple identities. Dissociative identity disorder. Dissociative identity disorder, DID, formerly known as multiple personality disorder, is a severe form of dissociation where an individual has two or more distinct identities or personality states that control their behavior at different times. Each identity may have its own name, age, history, and characteristics. Symptoms of DID. Presence of two or more distinct identities. Each identity has its own pattern of perceiving and interacting with the world. Amnesia. Gaps in memory about everyday events, personal information, or past traumatic events. Identity confusion or alteration, sudden changes in attitudes, outlooks, and preferences. Depersonalization and derealization, feeling detached from oneself and experiencing the world as unreal. Other symptoms: depression, anxiety, suicidal thoughts, self-harm, and other mental health issues. Impact of untreated DID. Interference with normal life. Memory loss and gaps. Individuals with untreated DID often experience significant memory loss or gaps. This can interfere with daily functioning, as they may forget important tasks, appointments, or conversations, leading to confusion and frustration. Identity confusion. Frequent shifts between different identities can cause confusion and distress. Individuals may struggle with understanding who they are and what they believe, which can disrupt their sense of self and personal continuity. Emotional instability. DID can cause severe mood swings and emotional instability. This can lead to difficulties in maintaining relationships, holding a job, or managing day-to-day responsibilities. Impulsive and risky behavior. Some identities may engage in impulsive or risky behavior, which can result in financial problems, legal issues, or physical harm. Social isolation. The fear of being judged or misunderstood may lead individuals to withdraw from social interactions, resulting in loneliness and isolation. Co-occurring disorders. Untreated DID often coexists with other mental health disorders, such as depression, anxiety, PTSD, and substance abuse. These conditions can exacerbate the symptoms of DID and complicate treatment. Impaired functioning. The cumulative effect of these symptoms can severely impair an individual's ability to function in daily life. They may struggle with maintaining employment, managing finances, and caring for themselves and others. Physical health issues. Chronic pain. Many individuals with DID experience chronic pain, which can be exacerbated by the stress and emotional turmoil associated with the disorder. Sleep disturbances, insomnia, nightmares, and other sleep disturbances are common, leading to fatigue and further impairing daily functioning. Gastrointestinal problems. Stress and anxiety related to DID can lead to gastrointestinal issues, such as irritable bowel syndrome, IBS. Self-harm and suicidal behavior. Self-injury. Some identities may engage in self-harm as a way to cope with emotional pain. Suicidal ideation and attempts. The emotional distress associated with untreated DID can lead to suicidal thoughts and behaviors. It is crucial for individuals to seek immediate help if they experience these symptoms. Identifying if you have DID. Questions to ask yourself. Do you have significant gaps in your memory about everyday events or personal information? Do you feel as though there are different parts of you that have their own identities and take control at different times? Do you experience sudden changes in mood, behavior, or preferences that feel out of your control? Have others noticed changes in your personality that you cannot explain? Do you have a history of severe trauma or abuse, particularly in childhood? Seeking professional help. If you suspect you have DID, it is crucial to seek a professional evaluation. A mental health professional, such as a psychologist or psychiatrist, can conduct a thorough assessment to determine if DID is present. Living a healthy life with DID. Seeking therapy. Trauma-focused therapy. Engage in therapies like cognitive behavioral therapy, CBT, and eye movement desensitization and reprocessing, EMDR, that focus on processing and healing from trauma. Dialectical behavior therapy, DBT, can help manage emotions and develop healthy coping mechanisms. Building a support system. Trusted individuals. Surround yourself with trusted friends, family, or support groups who understand and support your condition. Education. Educate your support system about DID to foster understanding and empathy. Developing coping strategies. Grounding techniques. Practice grounding exercises to stay connected to the present moment. Self-care. Prioritize self-care activities that promote relaxation and well-being. Journaling. Keep a journal to track different identities and their experiences, which can help in understanding and managing DID. Medication management. Consult a psychiatrist. Medications may be prescribed to manage co-occurring symptoms like depression and anxiety. Setting boundaries. Healthy boundaries. Establish and maintain healthy boundaries in relationships to protect your well-being. Work and social life. Balance work and social life to prevent overwhelm and stress. Mindfulness and meditation. Engage in mindfulness and meditation to increase self-awareness and emotional regulation. Yoga and relaxation. Incorporate yoga and relaxation techniques to reduce stress and improve mental health. Education and advocacy. Learning. Continuously educate yourself about DID and effective management strategies. Reduce stress and improve mental health. Advocacy. Advocate for yourself in medical and therapeutic settings to ensure you receive appropriate care. Conclusion. Understanding dissociation and DID is the first step toward managing and living a healthy life with this condition. With the right support, therapeutic interventions, and coping strategies, individuals with DID can lead fulfilling lives. Remember, seeking help and building a supportive network are crucial steps in this journey.